Dr. Sheppell, we had some technical difficulties at the end of our webinar, and we wanted to give you an opportunity to say your closing remarks and to mention something that we feel is very important for people to consider in getting the COVID-19 vaccine.
I wanted to mention two things, and these are issues that oftentimes come up in a doctor's lounge, and we always have discussions about new information. And one of the issues regards the long COVID, the syndrome where there's long-term effects from an acute illness, kind of like there were long-term effects that were noted to be affiliate with Lyme disease, with Epstein-Barr virus and chronic fatigue syndrome. These are symptoms that really are very difficult to put in place and to really make sure that we know exactly that they're related to the disease. But we know that depending upon the comorbidity and the risk involved in getting serious COVID, like with heart disease, lung disease, and cancer, that some of these symptoms are lasting longer than the acute illness itself, which lasts for about 10 days to 2 weeks. A lot of them would be related to things like fatigue and maybe a foggy feeling, a sensation with cognition and sharpness in our memory. Sometimes there would be aches and pains, arthritic type illness that would persist. And it really just, I think, would motivate everybody to reconsider really seriously about taking the vaccine because we really want to prevent the illness and this long COVID syndrome. The other thing we discuss is the reliability of the testing and whether we can rely on the test that we do for diagnosing the disease, the PCR test and the rapid test. We know that the PCR test is very reliable, but there are false positives, and people who don't have symptoms, a lot of times what would be recommended is it be repeated in 2 weeks after that to make sure that it's a reliable test. The rapid test is very reliable when it's positive, not too reliable when it's negative. So if we have a classic presentation, we should actually do the PCR test and try to make the diagnosis that way. So I just wanted to bring those two issues up before signing off. So thanks for joining us, and hope everything was informative for you.
Great, thank you, Dr. Sheppell.